fun little break. I hope everyone got outside to get some vitamin D this afternoon with that wonderful sun. I want to start out by saying I'm Jackie Schuett. I'm one of the Wisconsin Health Literacy team members. We are pleased this afternoon to share that this session is sponsored by the Institute for Healthcare Advancement. This afternoon we have Aziz and Katie. Aziz Abdallah is the Director of Strategy and Client Innovation at InPower, a Black and woman-owned marketing firm in Milwaukee. A lifelong entrepreneur dedicated to positive social impact, his career includes the development of digital platforms for African American print and radio outlets, as well as the creation of theinfluence.org, a news and information website focused on addiction and recovery. In 2018, he and his two co-founders launched InPower, providing marketing and outreach strategies for clients in the areas of healthcare, voting rights, economic development, and more. Abdallah holds a BA in business from Arizona State University. Katie over here, Katie Lepak, she is the COVID project officer for the Milwaukee County Public Health Collaborative, where she supports collective COVID response and recovery efforts among health systems, community health centers, local health departments, pharmacies, and community-based organizations. Katie holds a Master of Science degree from UW-Milwaukee and discovered her passion for public health while conducting water quality research in Romania and through an internship with the World Health Organization. Prior to her current role, she worked in research for the Wisconsin Department of Health Services and UW-Milwaukee and served as a public health officer in Milwaukee County for 6 years. Let's welcome our new friends.
Good afternoon, everyone. Thank you again so much for having us. Really excited to be here. I see a few familiar faces that I've actually never got to meet in person, so this is a unique experience, of course. As mentioned, I'm joined by my colleague Katie, as they say, my sister from another mother. We've worked through the trenches over the last few years together, so really excited to share some of the work that we've been able to do. Again, today we hope that not only can you walk away with some strategies around just building trust and collaboration within the spaces and the places that you all work, but also that you can really take away some tactical strategy from a digital standpoint as we talk about healthymke.com, which is a platform that we launched together alongside many other community members within the Milwaukee market. So we're going to get our trade-off down too, because obviously in this space we haven't always been able to present together. So we'll go back and forth. So go ahead, Katie.
Thank you so much, Aziz. We are so happy to be representatives, and I think first and foremost, we really want to lead with that. So we have the honor to share this work with you, but as Aziz mentioned, this work has had so many people who have contributed to it, who have been behind it, supporters of it, and have informed it along the way. So please just know that we want to bring those voices and perspectives forward in our comments to you today. So kind of set up the journey we hope to take you on, because this work really did come out of the emerging need of needing to communicate real-time information as COVID was happening. And so now over the course of 2 years, we've landed in a very different place where this platform is now being used to leverage information about immunizations broadly, being used to talk about health insurance enrollment and other topic areas. So really want to kind of set the stage of where we started and where we ended and where we're going to hopefully go on this journey together this afternoon. We are hopeful that you will ask lots of questions and we can have an active dialogue. So one of the things we really want to be sure to highlight this afternoon is talking about the collaborative framework. And that is really bringing together multiple stakeholders under one umbrella in the absence of individual brand. So you may have heard in the introduction, working under a unified emergency operations center across Milwaukee County includes 4 health systems, 5 federally qualified health centers, multiple retail pharmacies, 11 local health departments in our county, Lots of really important community-based organizations who have the credibility amongst our community to do this work. So when I left my public health officer role to step into this project coordination role, it's really bringing together lots of different players. So what is really unique, and you'll hear more about, is we were able to do that work in a brand neutral space. So there aren't logos splattered all over the place. Everybody just came together to get the information out. A big part of the work that we've done and have led with is building trust, beginning with an intentional lens of racial equity, making sure that we're inclusive, and that we are always reminded and grounded in sort of some of those charges that we put forward. So we created lots of charters along the way, and those were kind of our leading tentacles, if you will, and we really kind of used that as a North Star, which we followed throughout the work. And then lastly, we look forward to Aziz sharing some really interactive digital strategies that really help to move our audiences from awareness to action. We'll talk more about that as we move through the conversation together. But awareness to action is one of the key principles we've really kind of used. So I will pass it back to Aziz, and we'll start this journey. Thanks.
Perfect. Again, thank you so much, Katie. So the first part that we're really going to touch on is how we built this collaborative framework and what the inception of this project was really around. So here you see a friend of mine. His name is Khalif El-Amin. When it comes to Milwaukee, he and his brother are just really pioneers around civic engagement, entrepreneurship, the technology ecosystem for a lot of community members who are kind of in the emerging frontier spaces of Milwaukee. And in 2020, prior to healthymke.com, we had launched an initiative specifically to focus around testing, which is actually where Katie and some of the UEOC work came about around COVID testing. And we went under the project name testupmke.com. What we also noticed during that time, though, is there was Mask Up MKE. You had a pretty major election happening during this time. There were tons of billboards and just tons of information kind of saturating the market. And one of the things that we wanted to try to figure out and identify, just as a community of entrepreneurs and younger people in the marketplace really having a heart for service, is identifying how do we just come together, even if we draw everybody to one website and then we put everybody's links on there and get them to go somewhere else, how do we get to one consistent message that would ultimately allow for a place of credibility, uniformity, and really being able to engage with the audience in a way that would benefit everyone. And so when we look at kind of, some of the information that you see here, I can vividly remember the day that the election was happening. I probably got about 10 text messages. I can remember going to different websites and different places that I was just looking for information, and there were so many different sources of what was credible and what was truthful, but for community member being able to sift through that obviously was a little bit of a barrier. And so really, as we think about, one of the first grounds of the opportunity for coming together, it was how do we put the cause of the people before our own individual kind of merits and stakeholdership. And so that was really kind of the framework that became the inception around Healthy MKE, is coming together again for that common cause, not really putting our brand first, but putting a mission first. And that was actually the design of the name. What is something that we're all working towards in the midst of, having to wear our mask, having to get tested, not really being sure about when a vaccine was going to be available? What do we all want? We want a healthier community. We want a healthy Milwaukee. And so, working with the UEOC, I said, healthymke.com is available, .org too, .net too. Let's get it all, So you'll come to find, obviously, in this conversation today, I have a really optimist spirit. But that being said, they allow for the opportunity to really put that forth. And that was the beginning of fostering some of this opportunity. So Katie will talk about it a little bit more in depth on the ecosystem that existed around the actual website leading up to this point.
So the ecosystem, as we've touched on a little bit, was big. Milwaukee County, we have lots of stakeholders. We have lots of community members. We have 11 local health departments that make up 19 different municipal government structures. So there was a lot of government, those early days of COVID, as we're at that 2-year mark, we often use the word minutely now, which we didn't use before, right? Things were evolving and changing by the minute. And it was, how can we really deliver a source of truth to our community? So we had government folks, we had other city department heads coming together, routinely meeting multiple times per day, processing information. We think about our Joint Information Center, they were having sometimes 2 formal briefings with media, and we just sunset that last week. So we think about this journey together. Then we think about, we had healthcare, and they have all of the aspects of healthcare and our health systems and their communicators and their, emergency room physicians and everybody in between. And again, we have all of our really grassroots organizations. We have some key partners who have been credible sources to communities. And so leaning into them, leveraging them, empowering them to come to our table and say, we need your perspective. We can't do this work alone. And help us think together collectively about what we're doing. And then there was this whole communication sector. So we had a formal Joint Information Center, again, which was largely did media briefings. But then on top of that, there was really, what is the public information? And then what is the public education piece? And how do we craft those messages in a way that across this really dense and diverse ecosystem, we know people are going to take it back to their own agencies and have to put their own stamp on it, but what are the 2 or 3 key talking points in this brand neutral way that we can really align around, that we can all clearly communicate and amplify in this emerging, evolving time to help drive some uniformity and alignment? So again, this was our ecosystem. It was a challenge. We also think about language, right? So the Healthy MKE site did a phenomenal job of being available in multiple languages. And we really thought about what are all of our different channels and how do we leverage these, thinking about, again, health literacy. How do we communicate succinctly? How do we align messages? How do we do it in a diverse way? How do we empower culturally appropriate messages? How do we make sure that we're reaching the whole spectrum of everybody that is part of our community? So again, our ecosystem was complex, it was challenging, it was rewarding, and you'll see as we move through this conversation together how this ecosystem really was able to put forward some really cool stuff, sometimes in really short time periods, and other times with a little bit more bandwidth. So the next part that we're going to transition into is really some more details about the platform.
So a lot of times when I'm talking about anything, I like to start a little bit at the end and then go backwards as to how we got there. As Katie kind of talked about, that was the environment. And really, healthymke.com, when you think of a .com, a lot of times you just think of a website. But really, it really consisted of 4 different pillars. So again, it was a digital platform that individuals could find, obviously on a mobile device or a desktop. But then we also built a significant social following, and in addition to that, a database. So, as a best practice, one of the things that we always want to make sure is that if we're standing up a website, how do we continue to re-engage individuals who are visiting? So, making sure that we had opportunities for individuals to share their email to get updates. And I think one of the big things, especially in the early phases of the launch of the website, that allowed us to be able to leverage that was really around the fact that phasing for vaccine was a kind of what I would call an opportunity for us to be educators and make sure that people could find reliable information. So where you had phase 1A, phase 1B, at times not even know what phases would be, we really were an opportunity for individuals to identify, I'm in this age category and this is my email, and please notify me when I'm eligible to receive the vaccine. And that was one of our initial strategies to build the database. From there, we also consider some of the digital utilities. So when we think of that, we think about how do we create tools, and I'll just give a shout out to one of my partners here today from covering Wisconsin. How do we build tools that are able to be used across the board? So if we're gonna invest time and wanna be good stewards and partners around building a utility such as a database for individuals to subscribe to find out when they're gonna be eligible for the vaccine, how do we also make sure that this tool can be available on our partners' websites? So what we always made sure is that we did not put our brand forward on the tools that we were building, and we always made sure that it was something that if someone else wanted to make the information available on their website, we could do so. So that's what we reference when we talk about digital utilities, and I'll talk about that a little bit more. And then lastly is really the collective. So when you think of a .com, you don't really always think about the individuals behind the platform. But I would say as powerful as the website has been as a credible resource, the people and the groups who met around it to inform it were just as important. So, you know, time is a little bit of a blur, so that might be the only time that I get caught up today because I try to reference time and it just is a little difficult. But up until about 2 to 3 weeks ago, we met every Monday with community members to inform about what they were doing, what COVID vaccine clinics were happening, what events are happening that align with health messaging to make sure that the website is up to date and that they don't always have to be the only ones carrying the load of making sure that community members are aware of what's happening. So again, as much as the website was a tool in itself, building universal tools that can be used on other individual organizations' platform that may not have the internal resources, how do we do that? But then how do we also make sure that the ecosystem is maintained with it and that people can see tangible results? So if they send an event tomorrow night, it'll be up the next day. And how do we make sure that we keep that consistent? So that's a little bit of the framework as it relates to how we built some of what I would call the collective village around Healthy MKE as we continue to maintain it today. But I would say one of the biggest pieces that allowed us to be able to reach that was really around the trust that was needed to be built. Because at the end of the day, to say that health systems and government entities would always or are easily able to come into communities where you face barriers associated with trust, potentially with misinformation, potentially with historical reference, there was the significant need to make sure from the beginning of this work that it was community owned and led and also informed by individuals that are referenced as experts. I'll reference, the word expert came up in a conversation early in this work. And what expert meant to some individuals was my grandmother who's always taking care of me is my expert. But for some individuals, that meant, Dr. John from the Medical College of Wisconsin, and obviously I'm just using reference there, but really identifying how do we build trust in a way that ultimately allows for everyone to have a space of ownership in the space and the ecosystem that we're building. So Katie, you'll really touch on kind of the tactics and strategies that were used, and we've come a long way with that, I would say.
Yeah, so you'll see we kind of empowered key words, and the first word that you're seeing on the slide overhead is really listening. And this work was so grounded in listening, and listening in multiple ways, and really challenging kind of two things. One, we had to really be conscious about when are we the big partner in the room, right? So when are we calling a meeting? When are we setting a table? Who are we inviting? Versus how do we also show up in sort of a smaller partnership, so little p kind of way. So where can we be present and bring a perspective and also continue to listen and be supportive to partners? And so we used a lot of different channels to listen. You can see that's anything from focus groups, both big and small, personal phone calls, sharing in exchange, and then this really cool piece that came out at a much later date about these self-paced interviews. So thinking about how do we be interactive in a way, and how do we make a good on listening, right? So you can't just show up. You have to receive information. You have to be open and honest. I'm grateful for Aziz and some of our other colleagues. There were tables that were set where I, being the project officer, was perceived a different way. And there would be tense or uncomfortable situations. And again, because we had built that credibility, because we had a partnership where Aziz and others stood by this collaborative, stood by and supportive, they could help with some of those dynamics of saying, let's say that a little bit differently, or like, let me help you understand what we mean by that. And again, it's really that act of listening, being open to being vulnerable, to misstepping, are some of the really important things that we did. And when we took those messages away and we made good on them and delivered an outcome, and people saw like, oh, I was seen, I was heard, and now there's action based on the feedback that I have provided, it really gave us credibility. And that was important and foundational to this work that you guys get to hear about with us today. So coming out of that, right, all of that active listening really led us to build on and develop trust. So I think there's two elements of trust. One is there are lots of pre-existing partnerships before COVID ever happened. We are fortunate in Milwaukee to have an organization called the Milwaukee Healthcare Partnership. Their executive director is Joy Tapper, and she was somebody who was called upon in the very early days to say, we want you as a leader and others, and based on your infrastructure, to come together. One of the tentacles that came out of that is this project officer position that I've been fortunate enough to hold for over 18 months now. And so that's funded by local public health departments. It's funded by healthcare. It's funded by philanthropy. Again, it's all of those partners coming together to say, we recognize that we need somebody to lead us all together, and we are willing to put a financial contribution behind that, and we are willing to send our staff to these tables and to these meetings. And I think, again, it's because we had really strong principles. We were going to lead with reaching those who were most impacted by COVID, which in Milwaukee, there's lots of communities that faced significant challenges. As we learned about, who are the zip codes, who are the people, right? It's not just because you're black or brown, or it's not just because you live in this zip code. It's because you're my neighbor, and this is my community, and this is our home. And so as we were listening, it was really powerful when we could say, here's a specific word, particularly in some of the really impressive work that came out of this was the Authentic Voices campaign. Hopefully you've experienced some of that media. When you leave today, give that a Google or visit Healthy MKE. You can see more about that particular package. But we were able to really listen, and some people were putting forward a Let's Show Your Fight COVID campaign. And it was really interesting about that word fight and how people perceived it and what that meant to different people. And ultimately, we instead listened to all of these interviews and empowered the message of these community members with the key word that resonated for them throughout COVID. We were able to share our priorities and lead with them very openly, very transparently, continuing to name that racial equity is important, continuing to name vulnerable populations are where we are going to ground and really target the work that we're doing. And then also just having that open feedback loop and making good about it. And then again, just there was consistency. We showed up and we showed up and we showed up for the last 2 years. It's really interesting to come here, as Aziz alluded to today, because our cadence is in the shift for the first time. And so some of these meetings that it was, every day to, twice a week to whatever it is, we're at a much different point today, and we're thinking about how do we stand ready should that next surge happen or that next something happen, and how do we really build on the trust, the priorities, and the collaboration to keep it alive and well. So what was another really excellent part of the work, and I'm so excited for you to hear about it, is how we really empowered people who are of our community, from our community, in those focus groups, in those listening sessions. Some of the themes that came up that said, we want to see people that look like me. We want to see people who are from my community. We want them to talk like me. And they also gave the feedback of who's taking the pictures or whoever is putting together the production elements matters. It matters that they too are from our community, that they understand who we are and how our community works. And it also matters that they are compensated fairly and well for the work that they are doing. And so all of that came out of this active listening, these really important dialogues, and led to this next stage, which Aziz will walk you through, called empowerment.
Perfect. And again, kind of piggybacking off of what Katie talked about with the Show Your Fight campaign, which was one of the first kind of coined terms that was used to reference work that would come out of Healthy MKE. When we presented that to another audience, there was a significant amount of what I would call hesitation around the word fight, because what fight means in a certain audience may have a totally different reference for another audience. And so what we were somewhat challenged with is, well, how do we create an interchangeable kind of opportunity where there's consistency around our messaging, but at the same time we have diversity to reflect everyone's experience. And so what that ended up being was a campaign called Authentic Voices. And Authentic Voices was actually a show your blank, essentially. So we had some people who said, I want to show my care. We had some people who said, I want to show my love. We had individuals kind of expressing their opportunity within what they wanted to demonstrate as a result of getting their vaccine. And that was a campaign that actually ended up winning an Adweek award that really kind of, what I would say, put us on the map with the platform. But I would say the people who really made that happen were the people who are up on your screen right now. And so as Katie talked about, one of the biggest feedbacks that we got, and I think was a really significant opportunity to build trust within the community setting, was when people said, you know, I want to make sure that the person on the billboard is from my community, that you paid her for her time and didn't ask her for a favor, that the person behind the camera is someone from our community, and that you asked them, you made an investment within them. But one of the other opportunities we identified is when we think about scale, when we think about organizations that are startups, that are small businesses, we don't always have all of the necessary opportunity to demonstrate or execute at scale to this magnitude of the campaign. And so what was really unique alongside building the platform, I would say, was almost a form of an accelerator or a business incubator, because on the second picture is the organizational leader of an agency called Hanson and Dodge, which is one of the largest agencies in Wisconsin, and they actually donated their time. But in donating their time, one of the things that they did was partner with community members to really get involved in the production process and kind of foster a building of capacity. One of the things I'm really excited about to kind of share as a result of this work is I would say about 50% of these individuals are contracted with larger health systems, and we've never really done an evaluation around this, but really being able to identify that not only was there an impact around building trust around this work, but there was also an economic impact that will continue to sustain. And as a result, I think that also represents, you know, part of the trust that we were able to build around the website. So again, you know, this team is been incredible to work alongside and collaborate with and really be a part of. You know, all of the photos that you see in the whole presentation are individuals from the community that were a part of that campaign and taken by individuals that are reflected here. So again, I know this is a health insurance track, which for us, when we first got started with this, we were like, you know, this was really a good COVID website, but it gave us an opportunity to identify, well, how did we transition some of this initial ground fundamental work into another space? Because again, at the end of the day, during the pandemic, we also needed to make sure that individuals were enrolled in coverage. We also had some you know, special enrollment periods that had come up. And so we had this really large database of information and individuals who had subscribed to the website. We have built a significant amount of trust within this framework. And so as stewards, we really wanted, excuse me, to hold the responsibility of how do we take this same framework that we've built and make sure that we can start to integrate other messages that were relevant to the community that related to their overall health, which kind of talks about the overall digital strategies that we carried into the healthcare space that we'll go into next. So I'll hand it to Katie to talk a little bit about the model that we used in doing so.
Yeah, so this is the community health advocacy model. You heard us talk a little bit about it at the beginning. This is used in lots of different places or spaces, but for this work, the sweet spot for healthy MKE, which again started up as Test Up MKE, transitioned to healthy MKE, and then as Aziz was just alluding to, right, it was all about COVID communication, where to get a test, when to get tested. What about vaccine? Is it my turn? Do I need a second dose? Do I need a booster? And all of those pieces, do I need to wear a mask? Do I not need to wear a mask? What are the mitigation strategies? But then there are also other really important health issues that started to evolve. Health insurance enrollment, thinking about access to care, right? We're telling you to get a COVID test. We're telling you if you're at high risk, what that means and that you should consult a doctor. But what if I don't have a doctor? So how do we think about access to care? How do we think about flu? How do we think about all these other really important immunizations? How do we be intentional about our thinking that COVID immunization got so politically charged, but we have all these other really important immunizations that we also need to think about? So again, what we were really able to dial in over the course of the last 2 years is through this platform, through all of these different channels that you've heard about, we were able to really think about awareness, right? So what is the message we are collectively all gonna drum in this collaborative in a brand neutral way? So how do we communicate those 2 or 3 things? And then what do we want people to do with that information? And so how do we help get them to that endpoint where it's clear what they should do, it's easy for them to act on that element, and that they know where to go if there is a something more or something next. So really this sweet spot has been awareness to action. We have a lot of really great data that you're gonna hear Aziz speak to in the upcoming slides that will help demonstrate some of that evaluation about, were we successful, right? It's one thing to get somebody to come to your site, but then what are some of these creative strategies that we can think about and that we can use to capture action, if you will?
So the strategy that you see, obviously, many of us are familiar with the marketing funnel. One of my co-founders came up with, like, Aziz, it's a mic drop. And so, she came into the office one day and she loves to write on whiteboards. So she was just going away at the whiteboard and came up with this kind of acronym as a mic drop. And it's something that I would hope everyone could walk away with, because I think it's just a digital best practice. Obviously, I'm totally biased when I'm saying that. But at the end of the day, I think it's an opportunity for all of us to carry, especially within the digital and communication space within our marketing departments. So when we think about the term mic drop, really what we're looking at is the digital journey that an individual takes when they're responding to an ad or when they first visit your website. So again, when we look at the digital and technology ecosystem, Web 1, which is kind of the first version of online opportunities, was just going on as a consumer and being able to interact with information. The second version of the digital ecosystem and web and technology was the ability to do things like comment. So the first time that people could start to comment on blogs was really kind of a boom because it allowed people to interact with the information. And today, when you look at social media especially, which has really driven the digital and technology ecosystem, we evaluate the fact that people can video with one another, they can post, they can do a lot more, and they're a lot more empowered in their experience online. And so looking at this strategy, message, interact, convert, and drop, really what we're looking at is what I'll show in the next slide. So this is an example of a journey that we use specifically in the health insurance space to really create an opportunity for individuals to feel empowered and to have agency as they're interacting with content that we were delivering, specifically both in social, radio, and other mediums in which we were communicating. So the M in mic drop stands for your message. So what we've talked about all day, when you've spent time building inroads, when you have opportunities to engage with individuals that are in your target audience, really having an opportunity to allow them to inform your message is really the first thing that we evaluate, and how we're going to tee up those messages. So some of the things you see up there, when we were talking about health insurance, we were also talking about mental health as a priority as to why you should get coverage, because that came back as a significant priority from individuals in our community that were experiencing, obviously, the pandemic. In the bottom left, I think for you all, there's a mimicked pair of Jordan tennis shoes. So, one of the things that they set as a priority this year is, hey, we want to reach individual men of color in Milwaukee that are 18 to 25. Well, sneaker culture amongst that audience is crazy. You can buy a pair of tennis shoes today, resell them for double the next day. Anyone who's able to relate to that is totally familiar with what I'm saying. But we wanted to catch their attention, at least with something that we knew they would be interested in, and then get them to interact. So that's really that next stage of this funnel. So a lot of times when people have a social ad or an ad in the marketplace and someone clicks on it, there's kind of a subversive experience that a person will have to have, where they're scrolling on the page and you kind of hope for them to be able to take action on what it is that you want them to do. So the Savor tool is in this interaction portion, which is in the middle. And so last year we were, again, want to give shout out to Cover in Wisconsin, collaborate across the board within this space to be able to identify, how do we give a person an opportunity not to have to pick up the phone or fill out a form, but really give them a chance to interact with information before we're asking for a commitment or for them to take action. So in this message section, we were catching attention with messages that individuals had resonated within our focus groups. In the interaction section, an individual would be able to identify how many people were in their household and what their household income was. And in less than 1 minute, they would be able to identify what their potential next step could be. And that's where we looked at conversions. So an individual would see the message on social, then they would click and be able to interact with information, and then from there, we would identify, here are some of the options that you have based on the information that you shared. The real power behind this strategy is the fact that when an individual is able to kind of walk through a journey prior to making a commitment, the optimization and the results that we've seen of individuals following through was a lot higher than the year previous. And so, again, it's kind of a kiddie coin term within ourselves. Everybody here, I hope you take it and use it, but remember to go back to your marketing department and say, we're mic dropping from now on. So, but with this strategy, overall, these are some of the data and analytic points that I just wanted to share as a result of some of this work. So, with a 1-year launched website, organically from the ground up, we had been able to get over 400,000 visitors to the website, which represented over 1 million page views. And specifically in the space of health insurance and coverage, which is a little bit below, you see the traffic and completion. So again, really within our strategy, our goal was to get a lot of people to the page, to get them to interact with information, and then also be able to track where they were going once they left our website, because our strategy was really around awareness to action, and then hand them to partners that really drove around access, like Access Wisconsin, Was Covered, healthcare.gov, Cover in Wisconsin, individual partners that were in the space of helping build access. How do we get them there? So with that, we'll talk a little bit about the learnings, and as I shared with Katie at the beginning of the conversation, we much rather interact with the audience as much as possible, so we're excited to be able to hear from you.
So thanks for staying on this journey with all of us so far. Again, just really bringing it home, we kind of wanted to highlight these 3 separate parts. So part 1 was really collective collaboration. Knowing our village, knowing what other villages we wanted to be a part of, where could we join, how do we create that credibility, that trust, how do we become authentic partners in our community, right? How do we lead with collaboration? Again, how do we be really mindful about partnership? When are we setting a table? When are we calling a meeting versus When can I come to your table? When am I extended an invitation, and how do I show up? Even if I don't know why I'm showing up or what my purpose is, how do I be intentional to do that and be vulnerable at those tables? And how do we bridge those big P, little p situations, again, based in that really strong, clear tenets of why we're coming together? Hopefully you saw some great images. We hope you visit the website. We hope that you think about this, but really, how can you leverage that trust, which it takes time to build? You guys are all in places and spaces where you have existing trusted partnerships. Where are there new opportunities for that to grow or to expand? How do you really be intentional and vulnerable to let that audience that you're trying to reach drive where you're going to go? And oftentimes we say, we're looking at data and, it's our 65 plus. We need to make sure that they're boosted and they stay up to date. And how are we going to reach them? And we all have these great ideas, but Aziz or I haven't reached 65 plus yet. So how do we really know what means, what's going to impact them, what that's going to mean? How do we connect with parents of youth, right? Vaccination for 5 to 12, we've seen really low uptake, 0 to 4, lots of hesitancy, lots of questions out there. How do we set a stage using some of these really interactive tools? Come to the website. Hey, do you have a few minutes? Do you know what you're going to do for vaccinating your child? Have this really interactive conversation over our website, answer some questions, and then again, we can potentially compensate those users for their time, for contributing to our campaign. We can then work in our ecosystem to think about the data that's collected and then leverage all of these partnerships in a collaborative way to produce something that will hopefully resonate with the community, arriving at a point of we want you to make an informed decision, whether that's about health insurance, whether that's about COVID vaccine, whether that's about testing. We're not necessarily going to tell you what your end decision should be, but how do we make sure that we set you up in a way for success to have an informed decision? And you know what? If you're not ready to make a decision, how can we help you get connected to talk to others, to have some more conversation? And then the last part is really the digital strategies.
Yeah, so out of this, one of the terms that we came up with was the N of one. And again, a lot of this is really driven around Facebook. So if all of us open up our Facebook page right now, we're going to see something completely different at the top of our post. And that is driven off of the behavior that you have and what you ultimately are informing the platform about what you want to see. And so when we think about the N of one, that was really our strategy for the Savor tool. What one individual may need as their next step is completely different than what the next individual may need with their next step. So how do we empower them to really be their own agent within the tool that we've built to get to the next step of what they need? And then again, as we've talked about all day, really the audience journey, how do you make sure that all of the gaps are filled when a person is taking the next step and you're really removing any opportunities for kind of lag or drop off, as we would say from a technical standpoint. And then later, really around the delayed conversion. So as Katie talked about, one of the things that is always prominent on our website is how do we stay engaged and connected with you? And we are really conscious around how we engage with our audience. So we don't send a ton of newsletters, we send critical alerts. And we try to make sure that when we're doing that, it's information that's quick, concise, easily able to be received by the individual and available from an accessible way. So with that, Katie will talk a little bit about where our future is, and then we'll go ahead and have a discussion.
Yeah, so it's been a great journey for the last 2 years. We think about starting purely just as testing, right? What is a COVID test? Who needs them? Where to get them? What do I do with my results? What do I expect? And now we're at this different endpoint where we have a number of key strategies that we are bringing into the healthy MKE space. So really you're seeing that diversity in the content that is housed there. Really intentional conversations among partners about what content should come onto the site, what shouldn't, what are the rules, how is that negotiated, how do we build frameworks so that there's universal understanding around how that process is moving forward. thinking about, again, that interaction and what that data has shown us, how do we move to balance both videos and interactive versus just static copy that people are going to be reading and digesting? There was the creation of a community input council. There's this creative council and this collaborative framework. There's the community piece. Then there's sort of some organizations that come together to oversee Healthy MKE. Again, none of that infrastructure was there 2 years ago, but we have grown to these sort of councils and frameworks to hopefully set us up for success going forward. And then throughout this work, again, the stage was set long ago, but it was a leading principle to make sure that we were always leading with a lens of racial equity. And I say that and I pause on it because that's hard, right? What does racial equity mean? How are we doing this in this COVID emergency? Things are evolving, things are changing, and how do we really stay grounded and truthful to achieving racial equity? That's some big conversations, but it was kind of our North Star that we always came back to. And then just appreciating that we have a really dynamic healthcare landscape, right? Never before did we have pharmacy partners who delivered nearly 700,000 COVID vaccines in our Milwaukee County area for COVID vaccines. So thinking about them as a partner and how do we think about their messages, and not just big box pharmacies like Walgreens and CVS, but how do we think about our really important partners like Hyatt and other independent pharmacies. So the healthcare landscape was dynamic and complex, and it was traditional and non-traditional, and how do we vet, the person who's on the corner giving out COVID vaccines? Are they safe? Are they trusted? So we're super excited about where this work can go. We're super excited about partners who have engaged with us, who can think from their lens and the tables that they represent, that there's an opportunity here to really put these digital strategies together. So again, some of our work streams as of today that we are thinking about is really immunizations, particularly immunizations for children. So childhood immunizations have suffered a lot for lots of different complex reasons. People weren't going to the doctor. People weren't sure that it was safe to access healthcare. So how do we think about immunizations broadly? How do we think about flu vaccine? How do we think about access to care? What are the access points? How do people get connected to them? Insurance enrollment. And so under these new guiding councils and structures, we're super excited about the journey that we have moving forward. So with that, if there's any questions, we'd love to have an interactive conversation with those of you who have come on this journey with us.
All right, first of all, let's thank our speakers. They are so energetic and fantastic. All right, questions, raise your hand, I'll come to you. All right, you were my first one right here. Thank you.
First of all, thank you for that. That was so nice to hear about your journey and how thoughtfully you did every step of it. And I'm just thinking, so you created this, this amazing website with all this information, pulling the partners in, and I'm wondering then, once you had this great resource, how did you get it out there and promote it? How did you get it out into the community to reach those million views? Because that's the whole point, right? So I'd love to hear more about that. Thank you.
So I think it was really a multi-layered strategy. We had one arm of our work really focused on mobilization and outreach, and then another arm of our work focused on communication and traditional advertising. So I would say one of the biggest kind of break points with the website was we were really first to market around COVID vaccine information, and that gained some of our initial organic traffic. But then with the framework around the marketing strategy, so again, traditional billboards, radio, a lot of digital and print media. But then one of the other things that kind of ran alongside this project was a mobilization project. And so this was a group of 30 individuals who worked under 2 community partners that would actually go door to door and not only do education around COVID vaccines, but partnered with our local health department to actually administer COVID vaccines within people's comfort of their home. And so again, that came a little bit later once the website was already launched. But I would say that was the other kind of impactful piece around the work, was actually going and knocking on individuals' door who may not been aware or as included or had access at that point. Yeah.
So through the listening, Empower Aziz and his colleagues, one of the messages was, we want to hear from people who look like me, who are from my community, and so some of our reach was really able to be amplified by our local influencers, right? And I don't know who these people are, but Aziz and his team were great at finding out who they are, and they know a lot of them. But how do we intentionally include them? How do we give them the information so that they can then put it together and share it creatively in their own way? I think that's another point of how we were able to get some of that reach out there as well.
All right, another question in the back.
Well, kudos to you guys for accomplishing so much in the midst of all the chaos. Kind of inspiring for those of us who've talked about this. Now you've given us the foundation, so thank you. My question is, can we see a live example?
What do you want to see? Okay. Do I have access to the internet on here?
I believe so. Yes, yes.
I don't want to put you on the spot.
Oh, no worries. I apologize for whoever's computer this is where we're closing out Windows. Will this play audio?
Yes.
Okay. Perfect. So I think the first thing I'll do is I wanted to play a few videos because I think that kind of helps some of the storytelling. And we have a few different examples. So again, as mentioned, within the infrastructure, what we were doing, not only were we focused on community members that represented some of our priorities within our lens of racial equity, but then we also went at some of the niche markets that were in the audience that we were focused on. And so, one of the, I'll start with this individual who represents the Milwaukee Symphony Orchestra and just kind of show an example of some of the storytelling that was pulled out of this.
Professional cellist, musician with the Milwaukee Symphony. What I'm most excited to get back to professionally, hearing a full orchestra going full tilt in Bradley is tremendously exciting.
Let's get back to who and what we love, responsibly. Learn more about COVID vaccines at healthymke.com.
So that's one example, but to show an example of how impactful some of the team was with the production side of this work, we actually produced over 40 of those individual kind of storytelling videos over the course of a week. This was individuals that worked at restaurants, individuals that played in the symphony, individuals that were basketball coaches. So one of our strategies around content development was really designed to just, let's go out into the community almost like we're producing a documentary and just set people up and question ask and just engage with individuals at a time where we had the opportunity to. But the Authentic Voices campaign was really the one that ended up winning an award. So I'll show a few different versions of this, and then I'll also show the Savor tool.
Success doesn't have to mean getting the
Not
corner
my
office.
commercial disclaimer.
It isn't always climbing the corporate ladder.
Meet Gwen. At 19, she took over the care of her sister's children. Then she cared for all kids through the Milwaukee Teachers Union. Now she's caring for her community with this. Will you show your care? Learn more about COVID vaccines at healthymke.com.
And so I'll just call out, so this static was actually the billboards that we ran all over town. And so these were each individual kind of like at the close of their video had the show your, and then in white was kind of the word that swapped around. I'll show another example, but another kind of demonstration of just listening was also the example of how her name shows up and what neighborhood she's from. So, as a demonstration to community members of being able to identify where are these people from? Are these just stock people? We're, really creating that credibility around making sure that we're intentional in demonstrating where individuals were from. I also showed John. John is a really good story.
Doing his part for his country is what he's always done. He's got that old school fight in him, and he's still fighting with this. Will you show your fight? Learn more about COVID vaccines at healthymke.com.
So that's an example of some of the videos that were put in place, but now I'll...
Getting very close to the county line in the next...
Sorry about that. Again, so here's the actual website, and just to kind of demonstrate some of, so these are actually recent updates, on this homepage that are kind of, we try to update this at least once every other week, as long as we have relevant content. And as many of us know, there are potential changes that are coming with Medicaid, and so, oh, go ahead. Okay. So, also being good stewards and partners around the work, and as we talk about awareness to action, one of the things that we've been able to understand right now when it comes to the PHE unwinding is the best thing for an individual to do is make sure they have the app on their phone and get ready to be notified. So, in our conversations with partners in some of the convened spaces that we have, we give the information that we have available, but then these app downloads are actually promoting the Access Wisconsin platform. So again, being that local, hyper-local kind of trusted resource, but also making sure that we can, in some instances, co-sign for, state or system-driven partners, making sure that we make those connection points. And then I'll pull the Saver tool while you're...
Aziz, do you have easy access to your audio file, the wrap around getting enrolled in health coverage?
Man, you're putting me on the spot.
And
today,
if you don't, can you direct us where to find it? Because it is so fresh and exciting to listen to.
Let's see.
Makes me feel very old, but I like to hear it.
Yeah, this is what I'm gonna do as, go ahead.
Keep looking. So thanks for that. There are a lot of other creative strategies and pieces that got moved forward through this journey as well. So the creation of this rap video, there was a local dance team that put together a routine and encouraged, what was the endpoint disease? I think it encouraged vaccinations. Yeah. It was like a TikTok challenge that we rolled out in the community, trying to see if we could get people to pick that up. And can you videotape yourself doing this dance and amplify it? We think about some of our prominent healthcare partners. They all got really excited and said, we're going to do it. And so we held people accountable. And we can see some of our professional colleagues, out there doing this dance and recreating it. So if Aziz is able to pull this up, it's great. If not, we'll make sure that we get it out to you in our final 2 closing minutes that we have together. Any other questions? Well, Aziz is working on finding that for you guys. Yeah, way in the back it looks like.
Just a really quick question. I looked in the program and I looked on the app and I didn't see any contact information for you if we wanted to follow up with you with some other questions.
Yeah, no problem. On the website itself, there's a little chat person. It'll say, like, got a question. You go ahead and put a message into that and you will find Aziz or one of his teammates and you'll be able to find and get connected with us. So use the website if you're looking to have more information. We hope that you spent this hour with us. We are so grateful that you chose this conversation, that you showed up in this space. We hope that we were able to leave you with something that you didn't know. And we'll look forward to hearing from you. And thanks for all of the great work that each and every one of you is doing, because this is really important work. And we are glad to have you as colleagues alongside of us.
Technically, our session is ended, but we do have a 15-minute break, so if you guys want to hang out, I really want to see this wrap. So,
No worries. It was on the last iteration of the site, so I'm just getting it pulled up.